Fundamentally, the role of government is the safety net. And how do we make sure that everyday Americans don't fall through the cracks? So when we're talking about first-time tax credits for first-time home buyers, it's helping provide opportunities for newer Americans to get shelter and find their home, and they came to the American dream. Other policies also include increasing not a minimum wage, but a living wage. It fundamentally is to increase the minimum wage, but we should continue to tackle and progress until it's a living wage. How do we make sure that we have access to uplift the middle class by tackling universal healthcare, universal access, so that no individual chooses to go broke because they can't afford healthcare, which leads to those being unsheltered. If you don't have a living wage, it could lead to a pathway to be unsheltered. If you are paying exorbitant fees on student loans and your tuition, it could lead to a pathway of bankruptcy. If you have an opportunity of lack of healthcare and not being able to afford, it can lead to systemic problems in which you are injured because you can't get healthcare and you can't work to the fullest extent of efficiency. All these pathways lead to going into the mechanism of poverty. So the key question that was asked is, what are some of the policies to address these issues? And there are key specific policies to address them. It will not solve the problem in totality, but these are policies and proposals that we know have an impact in addressing the issue at hand. Well, let's talk about a few things. Number one, what is the problem? The problem is that everyday Americans struggle between choosing between putting food on the table or the price of their medication, especially for those who may be uninsured or unemployed. So how do we fundamentally address the issues and tackling the middle class? One of those areas, which is a right in my mind, is a value statement. So what is the value statement? Healthcare is a human right. No one should go bankrupt by receiving medications, life-saving medications. That is an American value that I have. So therefore, how do we implement policies that reflect those values? One of the ways that we can do it is lowering the cost of prescription medications, like, for example, the high previous cost of insulin. That was a federal program that championed by the Biden-Harris administration of lowering costs, especially when these are now generic. So how do we make sure that we tackle the issue of pricing, drug price transparency? And we think about the healthcare delivery system. It's the pharmaceutical industry, it's the pharmacy benefit managers, also known as PBMs, it's the insurance industry, healthcare providers alike. And so how do we tackle the multifaceted approach of healthcare delivery? And so specifically within pharmaceutical drugs and prescription medications, how do we make sure that we're allowing Medicare to negotiate drug pricing for the everyday Californians and Americans and lowering those costs? That's how we're going to get it to be fully accessible, and ultimately that's why I'm also advocating for Medicare for all, universal health care, universal access, and universal coverage, and making sure that everyday Americans have health care as a human right. So let's address the question about what is the challenge, what is the problem? The problem is lack of affordable housing. So what is the policy mechanism as to how we got here? It is fundamentally a supply and demand issue, an economic supply and demand. So understanding supply and demand, we need to increase supply. Well, what are the barriers to increasing supply? Cost of housing, labor cost, the bureaucracy and red tape. How do we make sure that cities will ultimately have the responsibility on the general plan? Cities are solely responsible for making the policy decisions on the general plan and improving housing developments. So the problem is that then the state has given guidelines for cities to meet certain housing goals. 97% of cities do not meet the goals that the state has allocated in meeting the housing requirements for a wide variety of different reasons that I just talked about. So how do we then, as government, help expedite and improve opportunities for cities utilizing the carrot or the stick and increasing housing development? So what is the carrot? The carrot is additional funding, helping to support funding to affordable housing, not just market rate housing, but affordable housing. How do we help implement policies that can address the issue of affordable housing? So for example, the state has passed policies to require, and many cities have adopted this as well, to to require developments with 10 or more units to be 15% deemed affordable. So again, a project that has 10 or more units must be deemed 15% affordable housing. So that's one way to help increase and address the issue of affordable housing. Having said that, in this market, developers will also tell you that they also need to make a profit. So they may look at higher density to maximize land use, to getting more market rate housing to subsidize the affordable housing. In answering your question then, we have also passed laws. Then if cities are not meeting their goals, they will not receive the type of funding. That's the stick. One of the plans that I am also in support of at the congressional level in partnership with Kamala Harris is a $25,000 tax credits for first-time home buyers. I also believe as a value, it is unconscionable. For example, in Stanford, Palo Alto, in this region, one needs to earn close to $300,000 to afford a single-family home in this district. That is unacceptable, especially when the average American makes $59,000 a year. Low income in Santa Clara County qualifies as $107,000 a year. I want to make that clear again. One will qualify for low income housing if you make 6 figures. You tell the average global citizen you make 6 figures and you qualify for low income, that is, people will laugh you out. So this is an imperative issue that we must address, and I'm kind of tackled a wide variety of different issues about economics and about social class, but you can't talk about affordable housing without talking about these fundamental issues of helping uplift the middle class, because these are all intertwined. It is unacceptable to me as an American that we see fellow citizens living on our streets. When you travel to many other countries, you don't see the same type of systemic problems that exist. So it is unacceptable to me, and does not reflect the values of basic humanity. So in the state of California and at the local level, funding is a significant issue. But when we're thinking about the systemic challenges and causes of homelessness, it is not just simply a supply and demand and housing issue. In other words, even if we had enough supply to house every single unsheltered individual, we still may see some challenges with respect to keeping individuals, given mental health challenges and given lack of economic opportunities to have the transition into permanent housing. So it's a multi-pronged approach. At the state level, we provided funding to provide cities opportunities to build shelters from temporary housing, and then allowing and providing wraparound services to getting individuals from temporary housing into permanent housing. And so again, how do we provide opportunities and tackling some of the mental health issues for some segment of the population, not all? How do we provide economic opportunities on job training and skill sets? But then also this becomes an issue of, will individuals, even if they're able to have a full-time job, be able to afford to live in these communities permanently? And again, as I referenced earlier, a minimum wage is insufficient for a living wage. That's why I'm also in support of increasing the minimum wage. And it should not be a minimum wage. A value that I have is we should be talking about a living wage, not a minimum wage. Everyone talks about increasing the minimum wage. I'm talking about increasing a living wage. And so funding is one mechanism. It is also making sure that we're expediting and passing policies that allow for shelters in this arena as well too, and building more homes. And that's where I think we will help address these issues, and making sure that, number one, it's supply and demand, increasing affordable housing, increasing economic opportunity for everyday Americans, and also increasing wages so that we can tackle the systemic problems of homelessness and those that are unsheltered in the first place. And finally, it's important especially for young people. We had an institution referred to as Agnew's Hospital in Santa Clara. This was tackling the issue of mental health in our region. Unfortunately, close to 15 years ago, that closed. And so, absent that of having institutions and the infrastructure in tackling mental health, individuals may not be compelled to seek treatment. And so it exacerbates the problem. So you cannot talk about the issue of unsheltered and unhoused without tackling the issue of healthcare and economic opportunities as well. It is not just simply a sheltering and a supply issue. It is talking about multi-pronged process, which is why all these questions, you see that there's an overlapping issue that's intertwined about how do we uplift the middle class, and that's why I'm advocating for how do we fundamentally uplift the middle class to be able then to tackle these issues of housing security, economic security, healthcare security, attainment, and educational values. These are all intertwined.